Hi, hi to everyone, and a very, very warm welcome to you all. We're so encouraged to have you join us for this webinar on small quantity lipid-based nutrient supplements, or SQLNS for short. For our French speakers, bienvenue au webinaire. La traduction est disponible en cliquant sur le globe en bas de votre écran. I'm Phil James. I'm a senior technical associate at the Emergency Nutrition Network, and I'm really delighted to be helping facilitate this webinar today. This webinar has been conceptualized and organized by the SQLNS task force, some of whom we'll be hearing from later in our session. Also, huge thanks to the Child Health Task Force, who have been instrumental in securing our French interpreters and spreading the word about this webinar. Please do introduce yourself in the chat, as some of you have started already, and where you're working from. If you have questions for our speakers and panelists, please use the Q&A feature. So today we'll be hearing opening words from Sean Baker and Rolf Clem shortly. And this will be followed by 3 presentations showcasing program learning of SQLNS. We'll then have a moderated panel discussion before closing, and I'll be introducing each speaker and panelist before their sessions. So without further ado, I'd like to welcome Sean Baker, Chief Program Officer at Helen Keller International, to open our webinar with a few words. So over to you, Sean.
Thanks so much, Phil, and thanks to the Emergency Nutrition Network and all the partners behind this. I was going to start my comments just going back to the true crisis in children's diets. We know as nutrition people that that period of 6 to 23 months when breast milk alone is no longer enough, getting adequate nutrition is absolutely essential. And I think it is unfortunately an area where we have fundamentally failed. And there are 2 flagship UNICEF reports which really underscore that. The 2021 Fed to Fail report from UNICEF really underscored the crisis of children's diets and indicates that 71% of children in that age group across the world do not have minimum dietary diversity. And then another flagship report from UNICEF this year on child food poverty really shows just how extreme it is, particularly for those children the most left behind, and that over 27% of young children live in severe food poverty, which UNICEF defines as only 1 or 2 food groups, which is really extreme of how undernourished those children are. I live here in Senegal, and I can see the situation here, both through the numbers of, I think, around 10% of children of that age group get a minimum acceptable diet. And then in some of the programming we've done here as Helen Keller in collaboration with other partners, a baseline survey showed fewer than 4% of young children in that area getting minimum acceptable diet. Now, there are some solutions we know to improve that. And in that program, through a combination of behavior change, improved agricultural production, and access to fortified complementary foods, that was able to increase to about 24%, but still far, far below from the change we need. And it's in that context that these small quantity lipid-based nutrient supplements really are an incredible solution to helping address this huge failing in global nutrition, which is improving the diets of infants and young kids. And when I read, I've been associated with some of this research from different angles for quite some while. And when you look at the meta-analyses that come out across all these studies, it's really striking of the decreases in wasting, the prevention of wasting, with particularly high marks for severe wasting, reduction of stunting, and again, particularly high marks and reduction of severe stunting, reductions in iron deficiency, reductions in cognitive and developmental delays, and on top of all of this, a 27% reduction in all-cause mortality in that age group that's so critical. So this, to me, is really an incredible breakthrough solution. And on top of it, anybody who's worked in these areas see that kids and caretakers love it. And on top of it, it doesn't displace any of the good stuff. It doesn't displace breast milk. It doesn't displace other parts of a healthy diet for these kids. And I think we're really at a tipping point where the discussions are no longer about should we start going to scale, but really how do we go to scale? Which populations will benefit the most? And I was noting the numbers on this webinar. I think the fact that over 200 people have joined this webinar is indication of that tipping point and that real robust appetite to go to scale. Now, we are facing obstacles in scaling up. The one I hear, the refrain I hear most often is, oh, it's still too costly. I think that in nutrition, sometimes we self-censor ourselves too much. If we were in another field like HIV or malaria, we would not be saying, well, ARVs are too costly, we can never do it. It's more, this is what's needed. The evidence is strong. How do we bring the cost down and mobilize the resources necessarily to deliver? And I do think that we are at early stages in going to scale, and where we certainly can find cost efficiencies to make it more cost efficient. And this is a year of huge opportunities with the new wasting guidelines from the World Health Organization, small quantity lipid-based nutrient supplements being included in the World Bank Investment Framework for Nutrition, which was just published the beginning of this month, with the Child Nutrition Fund, which is hosted by UNICEF, is providing another avenue where partner countries can access funding both for the product and for the program delivery. And next year with the Nutrition for Growth Summit, I think it's an opportunity to really accelerate commitments, political commitments to put this onto national policies and financial commitments to put in the resources necessary to take this transformational solution to scale. I was looking back on the body of evidence that's on the University of California, Davis website page that's dedicated to this. And I noted, and it was quite sobering, that the journey to generate this evidence has been almost 2 decades. It's been more than a labor of love. It's an incredible effort to generate this evidence of the incredibly powerful impacts of these solutions. And I think that the children whose lives will be saved and enriched by benefiting from these supplements cannot wait another 2 decades to do it. And I think this webinar is in a situation where it's so important to accelerate the implementation, the impact, so this evidence is really translated on transformational impact on the ground. So thank you very much, and I'll turn it back over to you.
Thank you so much, Sean, for your thoughts and your motivation. And I'll now invite Rolf Clem to join us to give an overview of SQLNS itself and the operational guidance that the task force have published recently. So Rolf is Vice President of Nutrition at Helen Keller International, and he's chair of the Operational Guidance Working Group. Thanks, Rolf, and over to you.
Thanks, Phil. Thanks, Sean, for a wonderful opening, and thanks to the Emergency Nutrition Network and the Child Health Task Force for hosting this. So good morning, everyone, and thanks for joining us today. And I'm excited to take you through a very important operational guidance document that will help move us from theory to practice through the use of small quantity lipid-based nutrient supplements, or SQLNS. So in today's presentation, we'll walk through the newly developed operational guidance document that provides practical, actionable steps on how to incorporate SQLNS into existing programs, helping us to transition from the robust research evidence base that Sean talked about to real-world implementation. So let's get started. Next slide, please. So in many communities, local diets, as you heard from Sean, just can't cover all the nutritional bases. And that's where specially designed products like fortified complementary foods step in to fill those gaps. And here we see the different types of lipid-based nutrient supplements, or LNS, and how they are applied in both prevention and treatment of malnutrition. We will focus on SQLNS today, which were designed for the prevention of malnutrition among children 6 to 24 months of age. Next slide, please. So let's take a closer look at what SQLNS are, what they really are, and why they're so effective in preventing malnutrition. So SQLNS are specifically designed for children 6 to 24 months of age in high-risk, food-insecure settings, where their diets often lack essential nutrients. These supplements come in small 20-gram sachets, about 100 to 120 calories, or 4 teaspoons, and can either be mixed into a child's food or consumed directly. The small quantity was designed to avoid displacing breast milk and locally available nutrient-rich foods, and make it likely that the child can consume the entire ration in one day, thereby receiving the intended doses of the micronutrients. Each sachet is packed with vegetable oil, legumes, milk powder, and a blend of 22 essential vitamins and minerals, including important nutrients like iron, vitamin A, B vitamins, which are often deficient in children's diets. They also provide key fatty acids that promote growth and development. The small size of the sachets makes it easy to distribute and store. Next slide, please. As Sean mentioned, evidence from 14 randomized controlled trials over the past almost 20 years involving more than 37,000 children across Asia, Sub-Saharan Africa, and Latin America underscores the broad impact of SQLNS on children's health. When given to children 6 to 24 months, SQLNS reduces stunting, wasting, and severe forms of these conditions by 12 to 31%, while also cutting anemia prevalence by 16% and iron deficiency anemia by 64%. Importantly, these effects are consistent across diverse regions, despite differences in stunting and anemia prevalence and health burdens like malaria. And as also mentioned, beyond growth and nutrition, SQLNS also supports developmental outcomes, lowering the risk of delays in language, motor, and socio-emotional skills by 16 to 19%, and is linked with a remarkable 27% reduction in mortality. But there's also more. SQLNS has shown potential to boost engagement with other health services by increasing caregiver visits to health facilities for SQLNS distribution. Programs can use this opportunity to promote other preventive health services, such as immunization, growth monitoring, and infant and young child feeding education. This increased contact builds trust and fosters greater overall participation in essential health services. And compared to other interventions, SQLNS uniquely combines growth and developmental benefits, making it a cost-effective, adaptable solution for integrating with existing health and infant and young child feeding programs. Next slide, please. So let's delve into the operational guidance document. This document offers practical guidance tailored for policymakers and program managers. It includes evidence-based best practices for every step of the process, design, implementation, and monitoring, ensuring that these programs are both effective and sustainable. It also features case studies that highlight how context-specific differences impact program design and outcomes, providing real-world examples to inform better decision-making. To download the full document and explore all the resources it offers, you can visit the website on this slide. Next slide, please. So the guidance document is organized along 4 critical stages of successful program design and implementation, each of which builds on the previous one. So verify the preconditions, which means confirm the readiness and appropriateness for SQLNS. Integrate SQLNS, which means embed it into health services and community platforms. Implement, which means plan logistics and train staff. Supervise and monitor to track the program quality and impact. So let's delve into each stage more specifically. Next slide, please. So verify that the preconditions are met. This means really assessing the local nutrition situation to see if it's appropriate to use this intervention and integrate it. And that means gathering the appropriate data on child malnutrition indicators, stunting, wasting, anemia, mortality if it's available, using credible sources such as the DHS, MICS, SMART data. Where local diet data is unavailable, use the closest geographic matches, review complementary feeding practices, focusing on dietary diversity and meal frequency. Check food security levels. Use tools like the IPC and Hunger Map Live to assess food security. And in high food insecurity areas, that is where the IPC phase 3 or greater, pair SQLNS with food assistance to ensure families have sufficient nutrition. And in lower food insecure areas, those in IPC 1 and 2, SQLNS can remain a beneficial part of a broader package that includes infant and young child support. You'll also want to evaluate the policy and enabling environment. Review the national and local policies on health, nutrition, and WASH. You'll also want to map existing programs and delivery platforms to see where SQLNS can best be integrated. Obviously, you'll need to engage stakeholders early, bring them together, government, UN agencies, NGOs, to, again, secure their buy-in, inform them about the potential benefits, explore ways to obtain political and financial support. You also need to look into importation and sustainability issues. Next slide, please. Stage 2 is all about integration of SQLNS. Starting SQLNS supplementation at 6 months yields the strongest benefits, especially in high-risk, undernourished populations. And targeting should focus on these vulnerable groups with either blanket or subgroup distribution. And as I mentioned earlier, in high food insecure areas, one needs to pair SQLNS with household food assistance to ensure families have their basic needs met. The ideal distribution is 12 months, from 6 to 18 months of age for optimal growth, anemia prevention, and iron status improvement. Distribution of SQLNS every 2 to 4 weeks is needed to reinforce adherence through regular contact. For less frequent distribution, for example, every 3 months, you need to maintain monthly check-ins with caregivers to ensure proper use and consistent adherence. SQLNS should always be paired with social and behavior change communication to promote healthy infant and young child feeding practices. This is not a standalone intervention, and so it's critical that it is paired with complementary interventions. Delivery can be seamlessly integrated into a number of different platforms, such as growth monitoring, infant and young child feeding interventions, CMAM and immunization, and using health posts, pharmacy shops, and social assistance program registries can extend its reach and improve its sustainability. Next slide, please. So let's talk a little bit about the basic implementation stage. And this requires logistics management and maintaining a reliable supply by ensuring quality control, secure storage, and efficient transport. Obviously, since this is a product, effective inventory tracking, making sure expiration is monitoring and there's a stock rotation is critical. Training is critical as well. One needs to equip health and logistics staff with essential skills on dosage, caregiver guidance, adherence checks, and distribution logistics. Streamlining registration, attendance, crowd flow while providing comfortable waiting areas for caregivers is important. And implementing safe sachet disposal aligned with local waste practices. It's important to reinforce why SQLNS matters and provide caregivers with straightforward guidance and a reliable channel for questions, ensuring proper and consistent use. And finally, early engagement with government and local health facilities and NGOs and community organizations is important to integrate SQLNS into existing health systems. Next slide, please. And the final stage is supervision and monitoring. And it's all about running smoothly and achieving the intended impact. And effective supervision and monitoring are essential to track coverage, adherence to SQLNS regimen, and the infant and young child feeding practices. So regular site visits are really critical. And this means checking stock levels, storage conditions, adherence protocols, distribution points, ensuring product quality and availability. And it's more than just oversight. It's also about continuous improvement. Site visits allow teams to address any challenges like low adherence rates or stock management issues. And also getting caregiver feedback is invaluable. Next slide, please. We're excited to announce that we'd like to start a community of practice specifically for practitioners and program implementers who are actively integrating SQLNS into a core package of services. We're eager to gather feedback on this operational guidance. We want to hear what's working for you, what's missing, and where you think there's room for improvement. This is not just a one-way conversation. We envision this community as a practice as a platform to share lessons learned, tools you've developed for training, supervision, and monitoring, and to discuss challenges and solutions. And our hope is a year from now that we can revise this operational guidance and share the collective wisdom that we've gained from you all in the field. If you're interested, there's an email to send your name to on this slide. So please, if you're interested in joining that community of practice, we'll hope to get going pretty soon. Next slide. I'd like to acknowledge the members of the operational guidance working group who drafted the guidelines, and USAID and the Gates Foundation provided funding support for their development. Thank you very much.
Well, thank you so much for setting the scene so nicely for us. That was brilliant. And a warm welcome to everyone who's been continuing to join us. Currently 370 of you, which is wonderful. Thank you. We're going to move now to our presentations section. I will keep the introductions to each of our speakers very brief, but please look out in the chat. We're going to be posting each speaker's full biography, both in English and in French, in the chat. If you have questions as you listen to the presentations, please put them in the Q&A, and we'll have a chance to get to as many as we can in the coming panel discussion. So our first presentation is going to be delivered by colleagues at UNICEF Nigeria office. This presentation will be shared by Nemat Ajiboye, Chief of Nutrition, and Philomena Irene, Nutrition Specialist, and they're both at UNICEF Nigeria. Over to you, Nemat, and to Philomena. Thank you.
Thank you, Phil. It's such an honor and pleasure to be here and to be on this panel with Sean. Several years ago when the evidence on SQLNS came out, we spoke about how we can get it into a program context and to scale, as Sean said, and to have had the opportunity to test the use of SQLNS in a program context, thanks to Philomena, who led the charge, has been absolutely exciting. So without further ado, we're going to talk about the experience of using SQLNS in a non-research, non-humanitarian program context, but in a context where we see high levels of malnutrition of all forms, as well as poor dietary practices. We're grateful to the UK government for having funded this piece of work. And you'll hear me refer to, I laugh because the original name of the project was called PASNIP. And I always imagined a parsnip, and then it suddenly became CWIP, which I thought was a bit strange because it sounded like you were whipping somebody. But we'll refer to these two projects as we go along. They're just the same wine, new bottle. Next slide, please. So as I mentioned, we had the opportunity to test the use of SQLNS in 3 LGAs of one state in Nigeria, and that state is Gombe State, which you see highlighted there. It's one of the northeast states where we have high rates of malnutrition, rates as high as 45% of children are stunted, 23%, only 23% meet the minimum dietary diversity requirements, and very low, and only a third of children are exclusively breastfed. Next slide, please. So under the program and in keeping with both our strategy as well as UNICEF's global strategy, we had 3 pillars of work. The first was to look at the enabling environment, and we always say it's the evidence-informed enabling environment. So here, working with state and local governments to have enhanced institutional capacities, but really to engage them and get their commitment to scale up high-impact nutrition services such as SQLNS. The second pillar, and that's the deep dive today, is really about the delivery side. How do you deliver a new commodity, a new product such as SQLNS, and yet maintain not a product focus, but a whole of diet kind of approach? And that led to our third pillar, and I heard Ralph, I think, mention it in his presentation, that, you know, SQLNS is not meant to displace you know, other diets and other food-based strategies, but really to be incorporated in the diet of children. And so here we looked at the sociocultural practices, caregiving practices, particularly around men and fathers, and how they can be engaged much more. So those were the 3 key strategies that we used. Next slide, please. So I'll just give the highlights, and then Philomena will take on from there to go deep. We were able to test or pilot our work between May and October 21 to 22, so roughly a little over a year. We targeted, as per the guidelines, children 6 to 23 months of age, but I think over time we really realized that also looking at the 6 to 12 months is critical, because that's the real window of opportunity. We use the recommended dosage of 1 sachet a day, and mothers were given enough rations every 4 weeks during child welfare clinic days, where other services were bundled. And later in the slide, in the presentation, you'll see the impact of the use of SQLNS on those other services. So Philomena, over to you. Next slide, please.
Thank you, Nemat. Next slide, please. As Nemat said, the pilot was done for over a period of 1 year, from May to October 2022. For results area 1, creation of enabling environment, we are able to strengthen Gombe State Food and Nutrition Committee coordination to ensure that nutrition is delivered in a multi-sectoral approach, and to ensure financing for nutrition. We are able to leverage partnership with government, FAO, IITA, and develop partnership with private sector to ensure quality and effective coverage of nutrition services and intervention. And we are able to unlock resources from the government with a matching counterpart from UNICEF to scale up other high impact nutrition intervention. Next slide, please. Results area 2, which looked at system strengthening. SQLNS was delivered through the health system in Gombe State, and we were able to train 155 healthcare workers, build their capacity on infant and young child feeding linked with SQLNS. We trained community volunteers capacity on family-led MWAC, infant and young child feeding linked with SQLNS, and over 30 agric extension workers capacity on cultivation of climate-resistant crop, especially orange flesh sweet potato. Next slide, please. Results area 3, we looked at diet and practices. Well, basically, because Gombe State is a patriarchal society, we are able to work with men forum with the men's group to form community forums and for dialogues, both at the local government area, the ward and community level. I'm able to work with men's support group and women's support group to ensure that issues of infant and young child feeding is discussed, looking at the data in the state on how to improve them. We are able to come up with small doable actions to promote and protect good diet and practices. Next slide, please. Next slide. Generally, when we compare the administrative data at the health facility, we found out that with the introduction of SQLNS into the health system, we're able to have over 300% increase in IYCF counseling, 6% reduction in diarrhea cases, and 22% increase in exclusive breastfeeding practices by caregivers. This is comparing data of 2021 and 2022 from DHIS, the same period. Next slide. We have testament from mothers. We also conducted focus group discussion from mothers. And it was, great responses from mothers hearing that they could attest that SQLNS, because Gombe State is an agrarian community, and say, how do you describe SQLNS? And mothers told us SQLNS is like children's fertilizer, make our children strong, more energetic and fresh. We could see their hair was shiny, their eyes shiny, and their skin. They could really relate the improvement in their child welfare to SQLNS, which is when they started in introduction of SQLNS into their children's diet. Next slide. Next slide. What were the challenges? In implementation of the pilot project, we really found that child diet is really, there's deeply entrenched norms and practices that really impact child food diets in Gombe State, which has led to child food poverty. And the long overdue SQLNS led time for supply, because there was a time we ran out of supply. Then insufficient funds to meet the demands for SQLNS, because SQLNS is a self-selling product. We just found out that it promotes uptake of other services in the facilities, like immunization services, birth registration, family planning by mothers. So we found out that already it was just so many mothers came with their children. They wanted SQLNS, and we didn't even have enough. So what are some of the lessons learned? Lessons learned includes integration of SQLNS led to increased uptake, like I said, in other health care services, immunization, birth registration by mothers, as mothers were encouraged to bring their immunization card during IYCF section. Adoption of positive practice to empower community leaders, religious leaders, and fathers is effective in addressing harmful gender norms that affect diet and practice. Then we really need the importance of initiating local production in Nigeria of SQLNS to address shortage, just like RETF. Next slide, please. Yeah.
Thank you, Philomena. So I think based on all the challenges and lessons, we looked at what does it mean for us as UNICEF in Nigeria, as well as other stakeholders in terms of the policy and programming. And to pick up where Philomena ended, and Sean spoke about this, we have global supply chain issues with SQLNS. There's a price issue. And if we really want to make this commodity available, we have to make sure the supply chain is secured and pricing is brought down. So we're looking at local production of SQLNS in Nigeria. And I hope and pray everybody on this call that by Q1 next year, we may have 2 manufacturers of SQLNS here. The other piece you spoke about was financing, because the commodity is still relatively expensive, especially if you compare it to micronutrient powders, etc. Of course, we know the differences, but governments with finite resources are not able to look at procuring a more expensive commodity. So the Child Nutrition Fund really is something that we're leveraging. And we have states, a couple states now, that have already started to say they want to use the match to child nutrition match to procure SQLNS because they've seen the benefits. The third real piece in terms of policy and programming is to look at not just SQLNS as a one commodity, but I spoke to it earlier to say, how do we do the surround sound strengthening of food systems and making food systems work for children? including looking at innovations such as the complementary feeding bowl and spoon, the development of complementary feeding guidelines, which then incorporate SQLNS, as well as food and safety standards. Just to add here, big win for us in Nigeria just 2 or 3 months ago has been the inclusion of SQLNS in the essential medicine list, which gives a big boost to states and the federal government to procure. We also need to see that SQLNS, as it gets used in program context, that it's included into monitoring and information systems of the government, including logistics systems. Of course, there's a huge need for gender, a gender transformative behavior change strategy. Philomena referred to it, saying Gombe State is a highly entrenched patriarchal society, and ensuring that fathers were as involved and as engaged, and also took away some of the time that it takes to feed a child. We kind of moved that to the father's responsibility, was very interesting. And then Rolf referred to one of the benefits of SQLNS being on development outcomes. And so here's something that really helps to drive the early childhood development agenda into programming, and you can visibly see the outcomes as the testimonials from mothers showed. Next slide, please. So our key take home or takeaway messages are, when you start this, one really has to have something in place. I'm somebody who hates, and my team knows this, I stay away from training. But in this case, given the commodity, the fact that it's new, and the need to really ensure that we used well, we said we really need to build the capacity of those who would be delivering this. However, alongside with that, we recognize that it should not be a standalone intervention. While it's delivered through the health sector, it needs to be coupled with that food system and or social protection kind of lens, where it can be part of a social protection agenda. It should always be accompanied by IYCF messaging about the importance of a diverse diet. And I think Rolf mentioned that the recommendation is you can either use the sachet on its own or mix it with foods. And personally, as a practitioner in the field, I always say the better way is to mix it with a diet and not market it or do behavior change for it as a complete food. And I think just improving children's diets, and we've spoken about this before, the numbers that Sean shared on the rates of food poverty, especially severe food poverty, is key. And this is one way, it's kind of an entry point. It's a tool that one can use to address that food poverty and ensure that food systems are responsive to children's diets. So those are our key takeaways and lessons. Philomena, anything to add before we wrap up?
Yeah, just for me, I think one of the key things we need to know that apart from delivering through the health system, we really need to strengthen the community system. Like in Gombe State, mothers were given the MWAC tape so that they can themselves screen their children and also other family members to ensure that the children do not even get into the red zone. And they know the importance of screening, and also the consumption and production of food, like working with other partners that are strong in the food system, like FAO, Institute of Tropical Agriculture, to introduce climate resistance fruits and vegetables as backyard gardens. Thank you very much.
Thank you. Back to you, Phil.
Thank you so much, Namat. Thank you, Philomena, for giving us such a rich overview of all the work you're doing in country and such clear key messages. And I know you've squeezed this into a lot of travel and workshops. It's been wonderful to have you both. We'll now move to our second presentation, which will be given by Bana Abujude. Bana is a nutrition coordinator working for Goals Syria program, joining us today from Jordan. Thank you, Bana, and over to you.
Thank you. It's a pleasure to be here. So I am the nutrition coordinator at Goal Syria, and I'll be sharing some experiences from the ground, from implementing SQLNS over the last 3 years and onto the 4th in Northwest Syria. Next slide, please. So here we're focusing on, why are we using these products in Northwest Syria? Syria has been in conflict for over 10 years, so more than a decade. And this is not just the only thing it's been going through. It's in a state of perpetual emergency, and it's an ongoing crisis. Recently, they've suffered through the earthquakes that passed in February 2023, further worsening the situation, along with a lot of vulnerabilities that the population is suffering from. We see continuous internal displacement due to security reasons as well. We can see that the population is composed of almost 80% children and women, and more than 70% are food insecure. So naturally, because of all of these issues, we can see that malnutrition rates are quite high, where 20% of children are stunted, and the global acute malnutrition rates are above the alert levels. We also see that micronutrient deficiencies are quite high, affecting 50% of women and children that have iron deficiency anemia. Next slide, please. Next slide, please. Yes. No, sorry. You can go back, yeah. Additionally, we can see that the feeding and nutrition practices in mothers and children are quite poor. Very low number of children are breastfeeding. The dietary diversity in both children and in women is very low. So we're saying around 12% of women and children are only getting, sufficient diets. And we can see this from the graphs below, where you can see that women and children are majorly depending on staples, which is basically bread and rice, which is the cheapest commodity available. Next slide, please. So why are we using this product in Northwest Syria, SQLNS specifically? We're trying to target the children and women at the most critical point of their lives, which is the 1,000 days from conception up until the second year of birth, second birthday of the child. And these are essential years where there is the majority of growth and the ability to prevent malnutrition occurs. Additionally, we want to prevent malnutrition. We want to address these issues of iron deficiency anemia, and support to reduce the impact of food insecurity on these households. And as mentioned before by my colleagues, this product is quite accepted in the community. So families love it, children accept it really widely, and they love the taste. It's also it withstands really difficult situations. So it's very transferable, it's non-perishable, and which are really important characteristics for homes that are, families that are living in makeshift homes, living in camps, that need that, ease at transferring their items. And last but not least, in this situation where wash is an issue, and hygiene issues are being faced by the family, minimal contamination of eating it straight from the sachet is quite positive for us here, because you don't need to prepare it with any contaminated water or unclean utensils. Next, please. So where do we focus our distribution of these products? Mainly, we try to overlap with the highest severity of food insecurity, highest rates of nutrition insecurity, and we're talking about high rates of malnutrition, iron deficiency anemia, and most importantly, the complementary projects that we're discussing here, which could include food security and WASH implementation as well. Next slide, please. So in the last 3 years, a lot of our work was focused in these little clusters that you can see down there in the bottom left. That's Idlib, one of the governorates, and up there in these two scattered blue dots, that's Aleppo. And we were able to work in 20 locations. Next slide, please. As you can see here, in the upcoming year, 2024 to 25, we are going to have a much wider coverage geographically. We're able to cover much more sub-districts and locations in Idlib, and in addition to new locations in Aleppo. And this is quite majorly due to more availability of supplies and changing the mechanism of distribution, which has allowed us to be more efficient in coverage. Our supplies are provided as in-kind under the grant that is supported by USAID, the International Food Relief Partnership Program. And basically, this is how we are able to maximize our reach by having larger quantity over the next year. Next slide, please. So how are we using these supplies? Mainly, we are targeting or reaching children between 6 months and 5 years old. We know that the guidance recommends that we only distribute this to children up to 2 years old, but from feedback and our experience in the last 3 years, there's a really high risk for families sharing this across the household, especially because they're so food insecure, they're not being able to manage to cover the basic needs. And so providing these supplies for children that are as at risk of developing malnutrition, which are children between 2 and 5 years old, it's also quite essential we target them with these supplies, and to ensure that each child is effectively going to improve using these supplies. We also have another product there. As you can see in purple, these are the products that we also provide, which is an SQLNS for pregnant and lactating women. We're distributing these supplies in a blanket distribution, which means that if we're covering a certain community or a camp, we make sure that every child and mother is covered. No one goes unnoticed, no one is excluded from the service. And we provide them on a monthly basis to ensure adherence to the supply, to uptaking these supplies. And we set up different distribution points in the community. We try to make it as close as possible, but really we're dictated by the environment, by the security and the access to these communities. I'll show you in a moment how this looks. Something very essential for us is that because of the issues with the delay of producing these supplies and the supply chain until we get them inside Syria, we at least aim to distribute them over 6 months. And if we were able to increase the period, then we would do so. Next slide, please. So one really important thing that accompanies our distributions is information, sharing information with the families. It's essential for us to ensure that the community understand the importance of it and how to use the SQLNS. And here you can see that we developed at Goal in-house design brochures in Arabic, the local language, using images that are culturally appropriate to be able to support the families to get the information with the most minimal wording possible, and as much imagery as possible, so that it could stick in their minds and help them adopt these recommendations. So if you see the little sign of the sun and the moon, that's to identify that only 1 sachet should be taken in the span of 24 hours. Next slide, please. Here are different setups of how we are doing our distributions at Goal in Northwest Syria. So on the left, you have the female caregivers collecting the supplies, depending on how many children she has in the household, and is set up in a tent. On the right, you have the male caregiver collecting the assistance, and it's within a building facility. Next slide, please. Sometimes we have to set up in the community and we don't really have a physical space to be within, but we still try to make it work. Next slide. And as I mentioned, information is so important that we try not to share it only in text format and rely on the household to read it, but we also try to find any opportunity to share these key messages. And this could either be in a group session, or it could be something really quick in different setups depending on the space that we have. And targeting the male caregivers is a very important part for us to ensure that they are engaged in these practices with the children. Next slide, please. So here, this is another setup as well, where we're providing information to the mothers or the female caregivers, and it can either be just a really quick message while they're coming to collect it, as you can see on the image on the left, or on the right. If we are privileged to have some time to spend with them, then we would gather them and discuss in more details. Next slide. So what are we providing along with the distributions, along with these products? Something that's really important for us is information, but also the method of delivering this information and other accompanying messages that are very important and critical for child development and child nutrition. Focusing on the mechanism of communication, where we're promoting exclusive breastfeeding, promoting complementarity in their diets, and ensuring that they follow up with all services that support their health and nutrition. At some instances, we were able to provide additional cash and voucher assistance so that the household can be able to access more food for the child or the mother. We provide treatment for malnutrition, emphasizing that this product is only for prevention and there are other products that are used for treatment, or at least we will provide a referral to the malnutrition treatment. As you can see, this lady that works with us in GOAL, she's providing a training for the families on how to use the mid-upper arm circumference tape so that the caregivers can monitor their child's progression and their health progression, making sure that they're not falling into the malnutrition risk range, and if they do, so that they're able to know when to identify them and what to do. Other referrals that accompany our work is referrals to vaccination, health and protection services. Next slide, please. So in terms of other projects that are quite essential, as I said, food insecurity is really a big issue in Northwest Syria, and combining these distributions with food security assistance is essential for the situation. As you can see on the right, this image is when we used to distribute food baskets or food kits. Basically, we would have the supplies distributed to the same household. And then we transitioned to using cash and voucher for food security. And this is also accompanied with the distributions of SQLNS. On different occasions, we had the opportunity to combine it with hygiene promotion messaging and distributing soap along with these products. Next slide. So some of the challenges that encountered us, and this is to mention, a great thank you for the amazing team in Northwest Syria and the GOAL Syria team, because it really takes a lot of work, including operational, but also technical work that helped us overcome these challenges. But mainly, as you saw the map coverage previously, for us to be able to go from covering such limited locations of 20 locations up to 120 locations means that, we had some distribution efficiency issues that we were able to overcome by dedicating correct teams for, the logistic part, and then focusing our nutrition team for only the technical part of this project. Also combining rounds, basically combining assistances and giving more than 1 month's supplies for one household could be really risky, but on the other hand, providing monthly distributions is quite costly as well. Transportation issues in terms of inflation and rising fuel costs is a very common challenge as well, since we're getting these supplies from all the way from the USA to Syria. Third is the coordination and overlap, and here we're speaking about a lot of high-level coordination that has to happen within the organization, within different projects, providing different assistance with UN agencies, just to make sure that we're maximizing the impact of these products, but also not overlapping with other supplies that are being distributed. Data management is another critical point for monitoring, who are we sending these supplies to, ensuring that children that are becoming of age are included in the right time, and those that are, becoming over the age of 5 years old are exiting at the right time. Requires a lot of close data management, very detailed data management. When we multiply 30 sachets by the amount of people that we're distributing this over 6 months, we're talking about a large amount of waste that's being produced by these supplies. So this is another challenge that we face and we're working on as well. Measuring the impact of these products is also quite challenging because when you're doing blanket distribution, that means we're covering over 30,000 individuals at a time. And it's quite impossible for us to do anthropometric data collection for such a large population. So the most of our impact is measured by how many people we reached with these supplies. And we would need to rely on secondary information to see the impact.
I'm just going to have to ask you to move on quickly to the last 2 minutes. Thank you so much.
No worries. So the last two issues are actually the same challenge that we face, which is the perception and practices around, families don't really grasp the importance of these supplies. So they either end up using it, sharing it within the household, or even selling it in the market. And this is mainly because of lack of awareness, which is the lack of available key messages and communication materials that they can access. Next slide, please. So this is the final slide and how we hope that this operational guidance is going to support us and support other organizations, is to help us understand how, what are some innovative new ways of distribution mechanisms, how can we be more effective, how can we look into the logistics of the transportation, the storage, ensuring that we have the highest quality of products and that we're storing them in the correct way and dispatching them as well in the correct way. Waste management policies and practices to reduce the impact of these the sachets, setting monitoring indicators and ensuring that we're monitoring the market to avoid reselling. Developing key messages and information that is most important with sharing with the community that are specifically culturally appropriate is very important. And last but not least, also identifying and documenting individuals correctly and ensuring that we're giving the supplies to the most in need. That's all from my end. Thank you.
Anna, thank you so much for sharing your program experiences. Thanks for all the great photos and sharing your insights with us so clearly. Thank you, everyone, for your questions. By the way, please keep posting them in the Q&A section. Our third presentation today, our final presentation before the panel discussion, comes from Jerry Ezike, who is the Regional Program Director for the Mary Dina Foundation. So Jerry will speak to us about program experience from Nigeria, Cameroon, and Chad. So over to you, Jerry.
Thank you so much, Philip, and thanks to ENN for this opportunity to speak on our experience using SQLNS in the sub-Saharan region of Africa. My name is Jerry Ezike from the Mary Dina Foundation. I work as the Nutrition Director. Next slide, please. So just a brief background of the foundation. We are committed to eradicating global hunger and malnutrition. And to date, our food and nutrition programs have distributed over 55 million meals and supplements. We have programs cutting across various sectors, as you can see on the screen. Next slide, please. So talking about the Zero Hunger Program, we implement the Zero Hunger Program across Nigeria, Cameroon, and Chad. And this program is a preventive nutrition program, or it's focused on preventing malnutrition and also providing pathways to the treatment of malnutrition. We do this primarily through the distribution of specialized nutritious foods, such as SQLNS, and also in addition to other complementary activities, which I will explain more further down the presentation. The target population for this Zero Hunger program is children 6 to 23 months of age, and also pregnant and lactating women. And just to add that we started this program in partnership with IFRP in 2020, and has been running concurrently up until 2024. Next slide, please. So this is talking about the locations of the Zero Hunger program. In Yobe, Nigeria, we are reaching 12,000 beneficiaries monthly. In the far north region of Cameroon, specifically in the Minawao refugee camp, where there are over 70,000 inhabitants, we are also reaching about 12,000 beneficiaries. And in the Lac province of Chad, in the Liwa district of the Lac province, reaching about 6,000 beneficiaries. Next slide, please. And briefly about the context of these locations. These are conflict-affected locations, one with high levels of conflict-induced displacement, high levels of insecurity, and also have been affected in one way or the other by climate change. Nutritionally, there has been high prevalence of stunting, wasting, and other micronutrient deficiencies in these areas, as well as programs by government and partners trying to manage the nutritional situation, such as the integrated management of acute malnutrition and other nutritional programs, such as the targeted supplementary feeding programs, as well as blanket supplementary feeding programs. Next slide, please. And the way we target, or the reasons for these locations, talking about our criteria for using SQLNS in these locations, is mainly because of high prevalence of conflict-induced displacement, as well as high rates of malnutrition. For Cameroon, we have one of the largest refugee camps in the area with a lot of needs, especially nutritionally, and also in Lac province, where we have a multidimensional crisis in a way, having a lot of displacement due to not just conflict, but also due to flooding and climate change. Next slide, please. Why did we decide to use SQLNS in the program? It's one, because it improves growth and development among children. Across implementing locations, we have seen increased appetite among children using SQLNS, and also the benefits of SQLNS to lactating women has also shown increased breast milk production, and it has been useful to promote the practice of exclusive breastfeeding among benefiting communities. We all, as from previous presentations, we know that SQLNS does help with the reduction of undernutrition rates, as well as improved overall health and resilience among implementing communities. The use for SQLNS is vital because it aligns with the program goals of the Zero Hunger program, which supports the prevention of malnutrition. It also complements the focus of the maternal and child focus of our program, and it's very vital. It's a core ingredient of our preventive nutrition programs across these 3 countries. Next slide, please. Our implementation process is threefold. We start with pre-implementation process, which will mostly involve logistics, but also community engagement with local stakeholders, community leaders, religious leaders, as well as capacity building of staff, health workers, and also community volunteers on the appropriate use of this commodity. We also work very closely with government stakeholders, such as the primary healthcare authorities in these regions, to proper mainstream this commodity in nutrition programs. Our implementation process involves the distribution of SQLNS through platforms such as health facilities, community distribution points, and also mobile clinics in the different areas we work in, and also going with the recommended doses of 1 sachet per day per child. Progress is generally tracked through routine monitoring with daily, weekly, and monthly reports using various monitoring tools, as well as every year we have to do, apart from baseline and endline surveys, an annual evaluation is conducted to properly to measure the program impact and effectiveness. Next slide, please. looking at our distribution platforms or our delivery platforms, we use community distribution points in certain areas where there are long distances between health facilities and communities that should be benefiting from SQLNS. Thereby, we're bringing these commodities closer to them. But our preferred delivery platform is health facilities. Why? Because we are able to integrate the distribution of SQLNS with basic healthcare services using the existing healthcare infrastructure. And this collaboration is very important to improve the patronage of healthcare services. In Chad, we use mobile clinics. Why? Because of the different contexts we find ourselves in the LAC province of Chad. A lot of nomadic internally displaced settlements exist there, and especially with the security situation. So the mobile clinics is the method we use to deliver these commodities in Chad. Some alternative platforms we considered was door-to-door distribution, but for a large-scale implementation, this had a lot of logistical limitations. Next slide, please. So talking about our challenges, we categorize them into three. We have one of which is security challenges that is common to the regions we are implementing in. This could be in forms of riots or armed conflicts, and when they occur, or if they occur, they can threaten or delay program implementation across the area. Another challenge we commonly see is non-adherence to recommended dosage by beneficiaries in situations where family members or other people take from the rations given to the child or the woman. And last but not the least is supply chain issues, ranging from long lead times to get supplies. In addition, with poor weather during the rainy seasons, flooding can cut off some roads, especially in landlocked regions like Chad. We have to truck the commodities up there. So during the rainy season, it's really difficult to get our commodities in an appropriate time frame. So these are some of the challenges we face in regards to supply chain issues. Next slide, please. How do we mitigate against these issues? For security challenges, we have standard approaches like risk management, risk assessment and management plan to enforce this as long as other standard operation procedures. However, for non-adherence issues, we combat this using continuous community sensitization and also demonstrations on how to appropriately use SQLNS and the importance of using SQLNS by the intended beneficiary. And we also employ a method of returning old sachets to collect new rations. This is also a way to monitor adherence, but also to encourage recycling, as we know that these commodities can cause a lot of wastage. And for logistical challenges that I previously highlighted, we across implementing locations, we try and keep our main warehouses close to distribution sites, as well as ensuring that we are able to complete major logistical operations before the rains come in because of the situation with the bad roads in the regions. Next slide, please. And the operational guidance document, we think it's a good one in the sense that it provides stakeholders with clarity on the objectives of SQLNS, which I think was a challenge when we started because there was a lot of misunderstanding on the objectives of SQLNS, with people thinking it had a therapeutic, or with stakeholders thinking it had a therapeutic purpose. So that would have provided a lot of clarity. And I also think it would provide a form of a guideline for training, a training manual for staff and community health workers or community volunteers on the program itself, but also on logistics and caregiver communication, which I think is very important in delivering this commodity. And also we would, one recommendation we put in here is for it to also cover messaging and key messages for pregnant and lactating women that will receive SQLNS. Next slide, please. We implement this the Zero Hunger Program, through which we distribute SQLNS commodities with a couple of complementary activities, one of which is maternal, infant, and young child nutrition, specifically focusing on social behavioral change interventions through mother-to-mother support groups and cooking demonstrations, emphasizing key topics like exclusive breastfeeding, promoting best complementary feeding practices, as well as WASH activities, especially with focus on hygiene promotion in the context of preventing waterborne diseases such as cholera. One key success of the program has been through health promotion, connecting pregnant women or children to antenatal care and routine immunization services. We have done a lot of work in this regard because of the integration of distribution of SQLNS with the existing healthcare infrastructure, as well as mainstreaming protection issues to just for more comprehensive support to vulnerable individuals. Next slide, please.
Jerry, it's the 2-minute warning, so you might want to prioritize the lessons learned slide. Thank you.
All right, thank you.
Thank you.
So yeah, just to highlight the key point here of using SQLNS to improve exclusive breastfeeding rates. We have seen through our surveys, we have seen over a 3% increase in the number of women practicing exclusive breastfeeding who have received SQLNS. Next slide, please. And this is a story on how we use SQLNS to prevent a relapse of acute malnutrition. After the child was identified and referred to an OTP for treatment, we were able to use the SQLNS after treatment of acute malnutrition so that that child is not able to, so that preventing the child, Umar, from relapsing to acute malnutrition. Next slide, please. And finally, our lessons learned, which the first point here is about community sensitization, which is very vital. Community sensitization and stakeholder engagement, bringing a sense of community ownership for this program. We cannot talk enough about logistics and planning, which is key, and it can also determine how much time we have to distribute these commodities. One key aspect of the Zero Hunger Program has been linking SQLNS with treatment program, which we have learned is very vital, especially for children that have recovered from acute malnutrition. So if we are able to link the treatment services with preventive services like the distribution of SQLNS, this could be very vital. And then we cannot overemphasize the importance of integration of protection and nutrition services for comprehensive support to vulnerable individuals. And finally, I would say that it's very important that at the high level and also on the level of the field, for collaboration and coordination with other partners, not just distributing SQLNS, but also with other treatment programs and also with basic healthcare services, because this synergy is very important for all-round added value to the beneficiary and to improve the general outcome of this program. So thank you very much for your time.
Jerry, thank you so much. Sorry for rushing you at the end, but thank you for sharing all your challenges, solutions, and lessons from the region with us. We're going to move to our panel discussion now. And just to say, we're keeping a record of all your questions. Any we don't get to today, we'll make sure we pass on to the SQLNS task force. So I'll invite all speakers to please share their camera with me and join me on the screen. And in addition, I'd like to introduce to you 2 new panelists. We're very fortunate to have Celine Zongo, who is an epidemiologist at the Ministry of Health in Burkina Faso. Welcome, Celine. We're also really happy to be joined by Dr. Irene Atanga. Dr. Irene is a medical referent at the Alliance for International Medical Action, ALIMA. And the session will be moderated by Christine McDonald, an associate professor at the University of California, San Francisco, and a core member of the SQLNS task force. Just a note to say, Celine will be speaking in French. So to hear the English translation when she's speaking, please go to the globe at the bottom of your screen and select the English channel. Over to you, Christine. Thank you.
Thanks very much, Phil. And thank you to all the presenters for some wonderful case studies. Today's first question is for Celine. And our question is, how did the government work with the World Bank to incorporate SQLNS into its nutrition programming in Burkina Faso?
Ok. Merci d'avoir associé le Burkina Faso à ce panel. En rappel, il faut dire que le Burkina a mis en œuvre la supplémentation en SQLNS au profit des enfants de 6-23 mois au Burkina depuis 2022 grâce à l'appui technique et financier de la Banque mondiale à travers donc le projet de renforcement du système de santé. De 2022 à 2023, le Burkina a couvert 3 régions sanitaires sur 13 régions que compte le pays. Et de nos jours, 4 régions sont concernées par la supplémentation en SQLNS au profit des enfants de 6-23 mois. Comment avons-nous concrètement procédé? Il faut dire qu'après avoir bénéficié de la formation sur le guide d'orientation de la stratégie LNS, SQLNS, et ayant bénéficié des acquisitions des intrants SQLNS, nous avons d'abord fait une analyse des plateformes d'offres de prestations de services de nutrition au niveau pays pour voir les plateformes qui sied au mieux. Ainsi, au niveau de la première région, nous avons identifié la consultation du nourrisson sain parce que la consultation du nourrisson sain couvre les enfants de 2 à 59 mois et couvre largement la cible des enfants SQLNS. Et nous avons donc réalisé cette mise en œuvre dans 192 formations sanitaires dans cette région. Tenant compte également du contexte sécuritaire que vit le pays, dans les 2 autres régions, nous avons identifié des plateformes communautaires telles que les groupes d'apprentissage et de suivi des pratiques optimum d'âge qui regroupent 15 à 20 femmes autour d'une thématique de nutrition pour faire la promotion de l'alimentation du nourrisson sain. Et ces groupes sont animés par des agents de santé à base communautaire. Et profitant de ça, également assurer le dépistage de la malnutrition aiguë. Donc, ces 2 plateformes ont été identifiées pour pouvoir mettre en œuvre, donc, intégrer la supplémentation en SQLNS des enfants. Et au-delà de ça, il y a une série d'activités qui ont été déroulées. La première activité, c'était de pouvoir orienter donc les acteurs du système de santé ainsi que les partenaires pour discuter et présenter donc le choix du Burkina Faso par rapport donc à ces zones d'intervention et des modalités. Ensuite, les acteurs régionaux et le système de concentré a été également briefé sur la stratégie de mise en œuvre parce qu'ils sont chargés de la coordination de la supplémentation à SQLNS. Ça n'est suivi donc le renforcement de compétences des agents de santé qui sont en charge d'assurer cette supplémentation lors de la consultation nourrisson sain, intégrant bien sûr les conseils sur l'alimentation du nourrisson et du jeune enfant, le dépistage de la malnutrition et le suivi de la croissance. Les agents de santé à base communautaire ont également été capacités pour pouvoir donc assurer cette supplémentation au cours donc de ces cadres de rencontres avec ces groupes de femmes, d'enfants, de groupes d'enfants, de mères d'enfants de 6 à 23 mois. Et au-delà de ça, pour pouvoir suivre la mise en œuvre de la stratégie, la performance de l'intervention, nous avons identifié des indicateurs clés et avec la collaboration de la direction des statistiques sectorielles, nous avons donc intégré dans les outils classiques du système national d'information sanitaire ces différents indicateurs et données pour pouvoir suivre donc la mise en œuvre de la stratégie. Et ces indicateurs ont également été paramétrés donc dans le système DHIS2 pour pouvoir assurer le visuel mensuel à tous les niveaux et faire les analyses statistiques pour voir la bonne marche de la stratégie au risque de ne pas permettre donc les collectes parallèles pour charger les différents acteurs sur le terrain. Il y a eu également des activités de soutien telles que la supervision des acteurs sur le terrain pour s'assurer de la bonne marche de la mise en œuvre de la supplémentation SQLNS au profit des enfants. Il y a eu également le suivi et le contrôle qualité des données en matière de SPLNS, et tout cela dans le but de pouvoir assurer l'offre de services de qualité. Et il faut dire qu'au-delà de ça, après une année de mise en œuvre, nous avons fait une petite évaluation pour pouvoir assurer donc la continuité de la mise en œuvre de SPLNS. Et dans cette évaluation, nous avons apprécié les avantages et les insuffisances rencontrées dans la mise en œuvre de la supplémentation à travers les deux plateformes que est la consultation du nourrisson sain et la plateforme communautaire. Et le Burkina a décidé à l'issue de cette évaluation, bien sûr en tenant compte des bonnes pratiques et de la capitalisation, de poursuivre la mise en œuvre de la stratégie SPLNS à travers donc les formations sanitaires et suivant la plateforme de consultation nourrisson sain. Voilà un peu ce qui a été fait pour l'intégration de SPLNS au niveau du Burkina Faso.
Great. Thank you so much, Celine. It's helpful to have some additional experience from Burkina Faso. I think I'll move on and ask the next question to Dr. Irene. It's my understanding that the SQLNS operational guidance document helped inform your procedures for distributing SQLNS in Alima's ongoing Nutravax trial. So maybe you can tell us a little bit about the Nutravax trial and how SQLNS is being integrated into it, and how the operational guidance document has been helpful.
Hi everyone, good afternoon. Thank you so much, Christine, for the question. I'm so excited to talk about this. Alima has over the past 2 to 3 years developed a lot of interest in SQLNS because of the proven efficacy in reducing the rate of malnutrition. And being an organization that we do, medical nutritional intervention, over the past 2 years, I have worked in 2 programs. The first one, we did supplementation of the first 1,000 days of life for both the mother and child, pregnant and lactating women, as well as children between 6 months and 23 months. So with the SQLNS program, we were really fortunate that it started just when the guidance was released, and we didn't just use it, but we used it as a practical manual, and also our principal investigator used the major points, the major stages to develop an SOP for the implementation of SQLNS in the Nutravax measles research. Now, unlike the other programs where the other program I did last year in 2023, where we had a lot of challenge, the guidance has really been so helpful in the Nutravax measles project implementation, because it's a research implemented in a humanitarian setting. So we always fall back to what does the guidance say, and stepwise, as we go from stage to stage, we realize that using the guidance, we have very little or no challenge, right from requesting for orders from the company, getting to establish strong collaboration with Ministry of Public Health, with other partners, and the resources, that the links and everything that is packed filled inside this guidance has really been of great importance to us. It helped us to get to meet other colleagues, NGO partners and UNICEF, and even other partners that are implementing the SQLNS program. And so in the routine immunization program, and testing its efficacy as an incentive to boost the coverage of immunization has really been an exciting thing. It has been without major challenges, unlike the other programs where Halima has implemented SQLNS, where we had lots and lots of challenges. In my last program, we had challenges with importation because we didn't really, we were quite naive. We didn't really take time to read policies about the country, importation policies and policies with integrating a new product. So storage problem, cost effectiveness, and lots of things. We missed it out. The guideline has really helped us, to meet all our. Oh, Christine, can you get me? Hello.
Yeah, thank you, Dr. Irene. Your connection seems to be a little unstable. We caught most of what you were saying, so thank you for that. I realize we're almost out of time, so I wanted to maybe move on quickly. Thank you for sharing some information on the NutriVax program and the value of the SQLNS operational guidance document. I think we have time for maybe one or two more questions, and I'll take them from the Q&A box. There have been a couple of questions for Philomena and Nemat about local production of SQLNS in Nigeria. Maybe I'll ask both of you to comment on that and share kind of any experience on the state of local production and maybe how that has been developed for the programming in Nigeria.
Thank you. We've been trying to answer the questions online, so I hope we've done justice to some of them. But just broadly, we have 3 local manufacturers of ready-to-use therapeutic foods, and many of the ingredients are similar. 2 of those manufacturers have installed production lines for SQLNS and are in various stages of the process, including getting registration with the Food and Drug Authority, et cetera, et cetera. So we're hoping by Q1 next year, they will have fully quality assured production lines for SQLNS, both from the government as well as ourselves as UNICEF. But we're hoping and praying. I think there is a bit of confusion in the questions, maybe when people are talking about local production of comparing a commodity like SQLNS or MQLNS with like cereal blends, such as what is called Tom Brown. And that is managed differently by either health workers or women's groups or small local manufacturers. And I just want to emphasize that that is kind of a complementary food base, whereas SQLNS, the way we've used it, is more of a condiment to be added. And so the two should not necessarily be, they're more complementary in many ways than at competing with each other.
Yeah.
No, I think that's really fine. The answer is okay.
Great. Okay. Thank you, Nemat. Thank you, Philomena. I think maybe we'll have our last question is for Bana. You mentioned that there were some issues of sharing and selling of SQLNS, and one of the audience members is asking if you can provide some insight into the challenges, into the reasons behind this challenge and how the project overcame issues, related to sharing beyond the intended beneficiary and potential selling.
Yes, so there is a portion of the community that will always not see the importance of it. But the way that we've overcome it in the last 3 years is intensifying awareness, sharing information, and sharing experiences from the families themselves, because the families that actually use it and commit to it are the ones that are seeing the benefit and the impact, and then they're able to speak on their experience. So when the families don't commit to it with the advice of the 30 sachets monthly for 6 months, they won't see the impact, and they would think that this is a way to make money, so they will sell it to the market, because markets are quite readily open to receive these supplies. And the one thing that we can tell that if markets are able to purchase these supplies and resell them means that the community really do accept these items and they really do like these items. So awareness and also sensitizing the community leaders. We have a markets team as well that monitors the markets, so we keep an eye on any of the products that are being sold. We emphasize on the vendors, try to let the vendors not accept these items as well. So we try to block these channels as much as possible. And as I said, combining these interventions with food security, I think it creates sort of a sense of responsibility that if I don't take these supplies, then I might be, I know it's a little bit, you know, it's not the best way, but sometimes it's okay to know that this is, you know, you need the CVA assistance to support you as well. That's coming for food security to be able to overcome these economic challenges. The LNS is a support that you need to commit to. So these are the ways that we were working with. Yeah.
Great, thank you, Bana. That's helpful. I think we're running out of time, so I'm going to hand it back over to Phil to close us out and wrap up. Thanks to all of the panelists and the case study presenters.
Thank you indeed, Christine. Thank you all panel members. I'm sorry we ran out of time. So many questions. As I've said, we've taken a note of all the questions and we'll pass those on. So it's been really encouraging to hear throughout the sessions today about the potential of SQLNS, its effectiveness, and of course the wider package of interventions that surrounds it. And just on the screen here, as a reminder of what Rolf mentioned earlier, the SQLNS task force are inviting feedback on their operational guidance. So you can scan the QR code there, and that will take you to the document and also a survey. Please do take some time to fill out the survey and help shape future guidance. You'll also see on the screen and in the chat an email address if you're interested to become potentially part of a community of practice of SQLNS. Please do consider getting involved and sharing your experiences and questions. So it just remains for me to thank on behalf of the task force, USAID, the Gates Foundation, the Eleanor Cripp Foundation, and the Children's Investment Fund Foundation for their support of the task force. Thank you again to the Child Health Task Force for providing our interpreters. Thank you to our speakers, to our panelists, our interpreters, Annie and Catherine, and the numerous people who worked behind the scenes. Of course, thank you to each and every one of you for joining us today. And I wish you a great rest of your day or night ahead. Thanks very much.